Hey everybody, it's Dr. Mary Gardner with Lap of Love Veterinary Hospice here for another episode of my Facebook Lives on various topics. And today I'm bringing on a special guest to talk about laser therapy for our pets. And we'll get into a little bit of nitty gritty, but this will be a good high level overview, if you will, of what the heck is laser therapy, what it's good for, what it's not good for, and maybe the things that we just don't even know. So I know my special guest since 2004 when I was actually a vet student at the University of Florida. So that's not me. This is who I'm bringing on is Dr. Kristen Kirkby-Shaw, who I'm going to bring on my screen now. Doo-doo-doo. Hello.
Hey, how are you?
I'm good.
So great to see you. Go Gators.
Go Gator. Wait, where's my gator?
Yeah, there it is.
Yeah, so I know you see so many students back in the day, but when I was a freshman at anatomy, were you at University of Florida for your internship or your residency?
Residency. So I was my first year of my residency I was TAing anatomy. And that's when, so your class, and so my residency was 4 years and you guys were freshmen. So we went through the whole 4 years together. Yeah.
It was awesome. So
I know.
And your residency was in what specialty?
Small animal surgery.
Okay. So, and that's 4 extra years on top of vet school.
On top of so vet school, then a 1-year internship. And then our residency was 4 years because it was combined with a master's degree.
Oh, okay. And then
these are 3 years. Ours was special.
Okay. So now, as a surgeon, do you do orthopedic or soft tissue or both?
These days, just orthopedics. The practice I'm in right now is an orthopedic specialty practice and rehab. But there have been years where all I did was soft tissue. So I've done a mixture of both.
Okay. Now I see a lot of other letters after your name. I only have 3 letters. So you've got your master's, and then I think it's 8 years ago today, you got your PhD?
Yes, actually, yeah. So I got my PhD. So we were just talking about the wonderful Sheila Robertson. She was my mentor for my PhD. And my PhD was actually using lasers. That's how I have developed this background and knowledge in laser therapy. The research itself was really not at all clinically applicable to what we're going to talk about now, but it did get me very familiar with the science of lasers. Yeah.
Okay. So the sciencey stuff.
Yeah.
Now I know that the next one is the Diplomat of American College of Veterinary Surgeons.
Yes. Well,
and
so
then what's the
there's the CCRT. That's a certified canine rehab therapist. So that's basically a certification process that vets or physical therapists or veterinary technicians can go through to get certified in rehab. And then, DACVS, that's Diplomat of the American College of Veterinary Surgeons. And then the last one, Diplomat of the American College of Veterinary Sports Medicine and Rehabilitation. I like school. I really, really like school.
I know. So I tried to get my CCRT, which I'm
I'm there. Yeah.
Yes, you were one of my professors in that class, and I'm super close. But my during my last week of it, my Doberman got really he had heart failure, and I had to fly home early to let him, to give him his angel wings. And I just have never been able to go back. But rehab is just, I love it so much. And with end of life care, people would ask me like, why are you into rehab?
Yeah.
And the big thing is because we see so many dogs with mobility issues. Mm-hmm. And whether it's from arthritis, which is a big thing, and we will be talking about arthritis next month, but also neuropathies is.
Oh yeah.
And I, to be honest, when I was in general practice, I never even really thought too much of those because I'm always just thinking about arthritis and discs and things like that. But like the neuropathies are just so much more than I ever realized. And I appreciate it more with end of life care. Because I'd be pain management, and they're like, it's not doing anything, and they're sitting on their toes and like.
Yeah, I'm a big believer. I mean, there's a lot we can do with pain management and laser and acupuncture, but just keeping them moving, just the physical act of moving, I think is huge. I mean, it's as important as anything else that we do for these aging dogs. Yeah,
totally. So, and everybody knows I got my girl Sam, who's not well, and she's got mobility issues. And right, I'm always like, Sam, we got to go for our walk today, and she gives me the stink eye. But and then she's dragging her little toes. But that's a whole other story. Yeah. So this talk is going to focus on lasers. I have to say lasers.
Yeah, lasers. There's people out there now. In one of my slides, I have the Austin Powers laser. There's people now that don't recognize that, don't know what's from. So I think it ages us.
That was so. I know for a fact I have a T-shirt with cats with laser beams coming out of their eyes, and I was looking desperately for it today because I thought of all Facebook Lives I could wear my cat laser shirt.
Yeah.
But okay, so and I know lasers are so useful in many things, but can you tell us this? High level, what is this magic?
Yes. So lasers use light energy, but most of the time the light, it's actually infrared light. So it's not a visible type of light. If you're using a laser, sometimes you'll see a red light. Yeah. Most of the time that's an aiming beam. So most of the time, the actual energy, the photons, those kind of light particles, are in the infrared. So they're just outside of the visible spectrum. So I think that's one of the reasons that that it seems like this magical device is because you don't see anything happening. And with some of the lasers, you don't actually even feel anything. They may not be generating any heat. But what happens is these photons, so picture, I know this gets really physicsy and sciencey, but photons are little packets of energy that are made up of, an electromagnetic spectrum. So these little packets of energy get delivered into the tissue, and they are absorbed by cells, and they help the cells work at a better rate. They basically help generate the energy inside the cell, which is called ATP. So they help generate that energy, that ATP, so it makes the cells function better. That's on the most basic science level. If we skip a lot of steps, the end results of that are improved tissue healing and pain relief. So the main reasons that we use laser are for those two indications, some sort of tissue healing and for pain relief.
Okay. By the way, side note, I remember you at my sophomore year teaching us second intention healing. And I remember, and I weirdly loved wound healing.
It's awesome. Yeah.
It's awesome. And I had this one burn patient when I was in vet school, and almost her whole back was burnt off. And I was like, yes, let me see. And I wish we had lasers back then because I think it's super helpful with that tissue healing, right? So, okay, so I actually have a laser machine here. It's my show and tell. And there's a lot of different brands and manufacturers. But I wanted to bring it just so that way people can see, and I'm not going to turn it on because it makes this really annoying beeping sound and everybody would hear it. But they've got these different wands with different heads. Let me get rid of this little, everybody can see how great you are with all your names. Okay. Thank you. So basically you just kind of roll it over the area and there's some magic numbers that you put in here for the amount of energy and the amount of space, I guess, that you're using. Mm-hmm. So, but can we talk very high level? I know there's 4 classes, and let me see if I can get this right. Class 1 laser is like your CD player. Mm-hmm. Class 2 is like a barcode reader, like at the store. Class 3 is a lot are used in maybe can I get rid of some fat cells and things like that, or some collagen stimulation. But then there's the class 4, which is what I have, and it delivers more juice.
Yes, yes, you're exactly right. Just to add a little bit to that, so the classes are actually based on the ability of the laser to cause injury to the eye. So it's all based on kind of safety protocols. Okay. And any laser has a potential to cause eye injury, but the higher the class, the more risky it is. And a lot of that risk is based on how much juice, as you said, how much power is in it and how much power is confined in that area that you're delivering, that focal spot. So there's within class 3s, there's class 3A and class 3B. Class 3Bs are actually the original therapeutic and medical lasers. And those are the ones that, from a research standpoint, the vast majority of the research has been done with these class 3B lasers. And really the biggest difference between class 3B and a class 4 is the amount of power, the amount of juice in there, and how quickly you can deliver your dose.
Okay.
And with that, the risk for tissue injury, for eye injury, and for burning.
Which is why we must wear,
exactly,
like Bono, the best band in the universe.
Those are good. Yeah, those are stylish.
Oh, are they nice?
My laser goggles are not that cool. Yeah.
They're a little dirty. So, and we even have laser like goggles for the dog, like goggles.
Goggles, yeah. Yeah.
So everybody in the room's got to wear these to make sure that they're safe.
Yeah.
And I think it's really important with the time, because you can have these wiggly dogs that are not going to sit there for 20 minutes, lasering them. So if you can get that down to 4 or 5 minutes, that's why it's beneficial to have, let's say, a 4 over a 3B.
Well, so I'm gonna disagree there. So because I always have to come back to the research, and there's no research to show that faster is better. So there's one study using the companion laser, which I give huge kudos to them for doing this one study, but there's thousands of studies with class 3B. And so we don't have a clear comparison to know if you give that same amount of juice faster, do you get the same results as you would slower? I think clinically we do see that. And from a practicality standpoint, absolutely. And everything practical, faster seems to be better. Yeah.
But this is why you have all these letters after your name.
Why lasers feel a little bit more confusing than everybody wants them to be.
Right. You care about the research, which is important. So that's good. So, okay, now you talked about pain management. So it's good for pain.
Mm-hmm.
Like arthritis.
Arthritis, yeah.
And that's probably like so much in our dogs and cats.
Absolutely, in cats, yeah.
People don't realize how many cats.
Like 90% of cats, yeah.
Right now, isn't it 90% of cats over the age of 10 or something have arthritis and nobody knows it?
Exactly, yeah. It's crazy.
My cat is just laying in a sunbeam and I wouldn't know it, right? She's just laying there. Okay, so and I'm going to talk about like how long we should do in chronic versus acute. But there's other cool things which I found interesting when I was taking the course and your course and rehab too, is you could use it for things like bladder infections or like or IBD, so irritable bowel. Like, what's up with that?
So
a little face there.
So one of the mechanisms of action, we talked about tissue healing and decreasing inflammation. So anything that has an itis on it, so itis implies inflammation. So you could use it on ear infections that are inflamed to reduce that inflammation. Bladders to reduce, that inflammatory component of a infected bladder, or in cats that have feline. Oh, she's coming into the picture.
Hello, who's that?
This is Beans.
Beans.
Yeah, Facebook bombing. So anything really with an itis has the potential to benefit from it.
Okay. Now, what should we not use it on?
So when I said the mechanism of action is to help stimulate tissue healing, and one of the ways it does that is it makes new blood vessels come into an area, and it makes cells turn over faster, new cells grow. And so those two things are what we don't want to happen in the face of a cancer or tumor. So there's, really we want to avoid, or we want to not use a laser over a known area of cancer or tumor. The big question comes up when we have this in my practice all the time is, let's say we have a dog that has a bone cancer in their leg and we're treating them we're still trying to manage the pain that they have in their hip arthritis in their back. Is it okay to laser that area that doesn't have the tumor if they have a known tumor elsewhere? And again, going back to the research, there's still no research to show that lasers cause cancer or are going to make it worse. But it is still this relative thing. It doesn't make us feel good. It's not a great idea. So we will still treat an arthritic area that is remote or distant from the area of a tumor, but we're never going to laser over a known cancer. Okay. The problem comes up when we were talking about with Sam is cancers such as lymphoma or leukemia that are more systemic throughout the body or kind of spread everywhere. That's I think it's smart to use caution and not want to use laser because it can potentially stimulate those cells to divide more rapidly.
Yes, I know. With Sam, her cancer is systemic and in her spine, and I want to laser her spine, but I can't. So I can't.
I would stay away from that.
If it was a regular disc herniation.
Absolutely. This one here, Beans, she had 2 disc herniations in her life, and laser absolutely made her better. Yeah, we did have to do surgery. Yeah.
You're solid on that. It made her better.
Oh yeah, it definitely did. Yeah.
Okay, so how much treatment? And I know this probably changes with acute versus chronic, right? So what could somebody expect? How often we should do it? How long we should do it?
So how often? We think that there's a cumulative effect to it. So generally, we're going to recommend. And this comes back to the practicality standpoint. So you have a laser in your house. Should you be lasering yourself every day, every other day, twice a day? Probably not more than once a day. There, again, this is where it's hard to talk about it. It's frustrating because, I try to be evidence-based, and sometimes we don't have research to support it. There's some studies in rats that show that every other day was more effective than every day for wound healing. But does that translate to our patients? We don't know. Okay. So from a practicality standpoint, probably what I recommend is 3 times a week for 3 or 4 weeks to get started, and then maybe tapering it down once a week, twice a week, depending on how frequently they're coming in and how the pet's doing.
So cumulative, because you think it's like, what do you mean by that, right? So you kind of do a little charge up in the beginning, and then it's just maintenance.
Exactly. Yeah, I think it's you give one treatment, it starts to get those cells working, and then you give them another little boost the next day, and you start to get the process going. Okay. And then it kind of gets to a state where you just need to maintain, whether it's pain management. If we're talking about healing, then eventually you can stop it. For most of the time, for pain management, you're going to do more upfront and then typically do more of a maintenance program.
Now, what about like with neuropathies? Mm-hmm. What do you think about that?
Yeah, I think neuropathy, we're talking about just the functional part, where meaning the nerves aren't firing and making the muscles move, and the neuropathic pain component to it.
Yeah, right.
I think there's a place for lasers for both of those. There, again, back on the research, there are some studies that show that lasers can help nerves actually regenerate. And so some people will actually use the laser and treat along the path of a known spinal nerve.
Yes.
To that regeneration. Then also treating for the pain. And so most of the time for neuropathic pain, we're treating up at the level of the spinal cord. But I think for sure we can use lasers for neuropathies.
Okay. Yeah. Very cool. So hold on, I'm trying to read some of our comments that are coming in. First up, you got a little love coming in. I love it. So hi, Esther from the Netherlands. In the Netherlands, it is really new, the high power laser. Mm-hmm. We have it, but always have to explain to the other vets that it's super, and not even talk about human physio doctors. Almost nobody knows about high power lasers, so extra happy about this lecture. Now there's also like super higher power, like surgical lasers.
Oh yes,
like cutting skin. Totally different.
Totally different. You can't use your therapy laser to do cutting surgery, and you can't do your surgical laser for therapy. They are completely different mechanism of action. Totally.
Okay. Could I use this to help stimulate collagen?
Probably yes. Yeah.
But not my thyroid area. That I should be careful.
Yeah, not your thyroid. One of my vet techs actually did that, and she did a test that she felt like she did not feel good afterwards.
Really?
Yeah, she was like, "Is this really true that it's not good to laser your thyroid?" And she confirms that it is not good to laser your thyroid.
I'm glad I didn't need to do that. Okay, great. Brenda is certified on both lasers. We already discussed the difference between 3 and 4, which is great. So we got some vets on here too. Hi, Holly. Okay, so a little shout out to your website also. Wait, no, that's not the website I want. This is why I can't drive my own screens. This is the website. So you've got this website, Care for canine arthritis, because I have so many. This I should show. Canine arthritis affects 1 in 5 dogs, and you've got a ton of information.
At least it may actually be a higher number than that.
I think so too.
Yeah.
People just don't.
50% of cases go undiagnosed.
Yeah. And this is, it's interesting with me when I started doing Lap of Love, what made me sad is not the process of saying goodbye, but going into homes, and these animals 50% have not been seen by their doctor in over a year. Yeah. And I'm like, oh, we could diagnose. So then I come in there and like, what do you think is wrong? And B, we could have done something. And it's not always just medicine. It's things like laser. Rehab, like you said, is just so helpful. Yeah. And I have done my little study, a real study, and it's a very high percentage of pets that haven't even gone to their doctor before they're euthanized. So we can do so much. Merry Christmas, Bean. We got and then some shout outs for lab. Thoughts on how long patients should go after the loading period? Like that's like you said, it's really patient.
It's patient dependent. So what I'll say is, from a rehab perspective, I think laser is helpful, but it's just a piece of the puzzle. And so it's rare, next to never, that I'm going to recommend just coming in for laser. So in our practice, dogs will come back, usually for a maintenance program. They're coming in once a week, and they're having underwater treadmill. They're doing their gym exercises, their massage, manual therapy, maybe acupuncture, and then they'll have laser in addition to that. So again, sometimes it's practical, whether it's once or twice a week, but I think a once a week program that includes the exercise component is going to be really beneficial.
For sure. Here's a great question by Nancy. Recently, a vet told me that we'd have to shave her double-coated Akita to have successful laser therapy. Yes or no?
Yeah. So there is some research to show. So what happens is the laser energy gets absorbed by all of the tissues, right? Yeah. And if you're trying to target, let's say, a hip joint, and there you got double-coated Akita hair, there's a really good chance that most of that energy is going to get taken up in the hair before it ever even gets down to the hip. And so there is some research to show that it's more effective when you shave, and then also that it may be affected by the color of the hair and the color of the skin. So that actually research came out of University of Florida recently. So there was a paper that showed that dark-haired and dark pigmented dogs, the laser energy may not actually be getting down to the tissue, which is disappointing. But again, from a practical standpoint, I'd say in our practice, we typically don't shave the hair. Would we be getting better results? Possibly. So it's something to consider. Maybe if you're not seeing the results that you expect to see or hope, maybe consider shaving.
I know like it's sensitive, right? I had a Samoyed, and so like to shave my dog is like a big deal. And she had an FHO done, which is a hip surgery. And, so then she had a quarter of her body was just bald and horrible looking. And then I just shaved her whole thing. Okay. So, Leslie, here in the UK, wait, my screen jumped. Here in the UK, we had a live talk on laser therapy last week on canine arthritis management. So interesting to hear thoughts on this. Yeah, this is great. I'm so good. It's all over the world, which is awesome. So let's see, Teresa. For syringeal, I can't even say that word.
Syringomyelia.
Myellia, own it. My screen jumped. There it goes. More questions come in and my screen jumps. In dogs, would it be better to laser the spinal cord where the known lesion is, or where the pain seems? So this is a great question, right? So if I've got my issue is here, let's say, but the pain is radiating down my arm, what would you do? All of it?
Probably all of it. There's a question. So laser will penetrate bone. The question is it actually getting deep enough to treat that syringomyelia? If it's a herniated disc that's pushing on the spinal cord or pushing on the nerves, you can treat that area. The real question is it getting deep enough? I honestly don't know that I've ever treated a syringomyelia by lasering it at the site. It may be lasering it down the path of that spinal nerve.
That's a great question. So Bill, our cold laser would ask if the hair coat is dry or darker or light.
Yeah, so that's a really good point. So if you have dark hair, the laser will heat up that hair very quickly. You can burn the hair, you can singe it, you can cook an egg with that laser you have right there if you leave it in one place for too long. That's important to respect the laser. And so if you have dark hair or dark skin, you choose a setting that it does the magic in there and just adjust the numbers so that there's less risk of burning. But that's also why you keep it moving.
Yes.
So it doesn't heat up the tissue.
Yeah. Let me get rid of my little doodad here so I can see my thing. Yes. And then there's also I've got all these other little head attachments to keep it away from the body for especially those burns and things like that. You just have to switch up.
And there's, like you mentioned earlier, there's a lot of different lasers out there. There are some that actually don't generate heat, so you can keep them in one place and then move on to the next one. So that's why it's important, whoever's using the laser, to be fully trained and understand the safety aspects and how to use it appropriately.
Yes. Okay, Shauna, what do you think of laser therapy with massage?
Yeah, absolutely. Yes.
That's what I would say.
Absolutely combine them. Yeah.
Listen, Sam gets acupuncture, laser, water treadmill, and I would do, I'm sorry, not laser. Acupuncture, massage, water treadmill, and I would do laser if possible. Let's see, tune in a little late. Differences in hot or cold.
Yeah, the difference is in the hot and cold laser. So that's really, it comes back to the power, the amount of power or amount of energy that is delivered by that laser. Power is really how quickly you deliver the treatment dose. And if you have a high power, you deliver the treatment quickly, but it warms up and it's a hot laser. A cold laser is one that doesn't cut tissue and it doesn't generate that heat.
Okay. We were talking about the hair tattoos.
Don't laser over a tattoo. It hurts.
Right. Yeah. And a lot of dogs from shelters may have their tattoo numbers.
Yeah, so don't laser over that. That pigment is going to absorb the energy and it will heat up. It'll hurt.
I may have, or maybe not have, lasered my brother's shoulder and he has to.
And he let you continue?
Well, he was like, go faster.
Oh, yeah.
Okay, probably shouldn't have admitted that. My experience with treating humans is that my laser either works spectacularly or not at all. What's your experience with dogs with the same results? Her dog has shown no improvement.
Yeah, I would agree. I think Mary and I, Dr. Gardner and I were talking about there's so much we don't know about lasers, about what the right setting is. Should it be at a different setting? Should it be a different pulse frequency? There's so many numbers that can be adjusted in that maybe we're not using the right treatment setting. And every dog's going to be different. Their response to medication is going to be different too. We know that some dogs respond to our, Rimadyl and some dogs don't. So yeah, I do think that there's going to be variation in our patients.
Yeah. Okay. This question comes from Stephen Schultz, my friend Schultz up in Buffalo. And you may not know this, but I want to know this because I suffer from migraines. What about migraines in humans? I know this is about dogs.
I'm a doctor.
But I've heard about this. So
it probably does. Yeah. It does, like I said, it does penetrate the brain or the the skull, so you could get down to the brain. I know there's research in traumatic brain injury. People have looked at that. The biggest key there, I would say, is making sure that you've got those goggles on and you don't get that laser anywhere near your eye. So I don't know where you would treat, where you would aim.
Migraines are crazy, but
maybe. And so I don't do acupuncture, but maybe at the acupuncture points that you would use to treat migraines. So you can do laser acupuncture. Yeah,
even like right there. I was squeezing my hand all night long. Yeah. I love it. I just had to say that one because it's fun. So we've got some highs. Is cold or warm? Is cold or warm preferable for arthritis and neurological? Her dog has both. It's a Larpar dog.
Mm-hmm. So I think the question is, hot laser or a cold laser better? Again, we don't know. They both should be delivering. It's about the dose that you're giving. And so both of the lasers should be delivering that same dose. It's a matter of how quickly it's delivered, what wavelength it is. So we don't know yet which one is going to be better. And you can have two different hot lasers that have still different parameters in there, in the box, all the magic numbers that happen, and you may have different outcomes with that. It's apples to oranges when we're comparing lasers. So I don't think that or at least we don't know if there's one that's better or worse at this point in time. I would, in our practice, we have 3 different lasers. And none of them are heat generating. We've got 2 class 4s, but they're not heat generating lasers. They're just for safety aspects. And then 1 class 3B. And we seem to see results with all 3, but is one better than the other? It's hard to tell. Yeah.
Bill Marcus, we've used it post-op, post-dental, ear infection, along with ACL. Oh, I love it. The ear infections I've heard really good stuff about that.
Yeah. We use it post-op. All of our, we do a lot of TPLOs, and those guys all get lasered. The other kind of modality that hasn't come up is the pulsed electromagnetic field, a CC loop or the respond bed.
I want to do a Facebook Live on a CC loop because that's I have one.
Yeah, that's when I have an issue with my neck sometimes, and I have to put the loop around my neck while I'm doing surgery.
No way.
Yeah, it definitely helps.
Can you use those with cancer?
You can. Yeah, So
I was nervous, so I might be looping Sam later.
And the Larpar dogs, we put one around the neck while the dog is in for therapy, and because that might help with inflammation there.
I know I got a lot of Larpar fans or people that follow us.
I went through that with my last Labrador.
Did you?
I've done a lot of Larpar surgeries too.
Yeah. That's what my Doberman he had. Listen, that might be our February. You might have to come back in February. Gingivitis. Okay, listen, we could keep going on and on and on. It's awesome, but I don't want to take too much more of your time. Is there anything I forgot to mention or ask you about lasers? Gosh,
it is tough because there's so much that we can talk about. I would say, it really is. It's a part of an overall treatment plan. And I think there was one study, and I'm coming back to the research, that did show that laser could potentially reduce the need for anti-inflammatories. So, in some of those dogs that are intolerant of their oral anti-inflammatory medication, laser may be an option for those guys to help reduce their need for anti-inflammatories. What we didn't know from that study is how you had to continue the laser long term, or if you stop the laser, did they need to go back on their meds? So there's probably maintenance that's needed.
See now, and I was reading, and forgive me for my non-scientific way of explaining this, right? But there's the threshold of the nerves, and resting threshold is a number, right? -70 or whatever. And then when they're pissed off and in pain, it's -35, whatever this number is. And so then I heard that chronic or damaged nerves, their resting is at this bad pain threshold. And so the laser could actually change it so that way their resting is more towards that -70. How is that for non-scientific explanation?
No, I think you did a great job with that. Yeah. and that's right. That's back how the laser energy is affecting that cell. It helps stabilize the cell membrane with those ATP pumps. So it stabilizes the membrane so that resting potential gets back to normal.
That's about as much magic as I know.
You're exactly spot on. Yeah.
But I'll say I've had laser for myself. I'm going to embarrass myself a little, plantar fasciitis. And that and acupuncture together is what got me through that pretty fast. So I'm a huge fan of laser for humans and for pets. And so those that can, get it. Now, do you know if there's like a laser group? Like, how does somebody know if there's a vet near them? Is it better just to go through rehab?
Well, I would say it would be rare to find a rehab vet that didn't have laser. And I would recommend, if it's a mobility concern or a geriatric or that's the concern, I would recommend finding a rehab vet because, again, it's going to be part of an overall package, not just laser. I really, really believe strongly that it's part of the plan. And so you can find a rehab vet in your area. There's an organization called the American Association of Rehab Vets, or AARV, and their website is rehabvets.org.
Oh, easy.
Yeah, rehabvets.org. And there's a drop-down menu there to find a rehab vet in your area.
I can't say enough about mine here, and there's a couple nearby, and I adore them. So, and that's why I wish I would have. One day I'll finish getting my certification.
There's still time.
I'll get some extra letters after my name. And you're out in Colorado. Where do you practice?
I'm in Seattle. Yeah.
Sorry, Seattle. Yeah. Where do you practice?
Like Animal Surgical and Orthopedic Center, and then our rehab department is called Sound Veterinary Rehabilitation Center.
I love it. Yeah, I was thinking because last time I saw you was in Denver. That's
yeah.
Oh, good time. Well, thank you so much for coming on and chatting. I know we've got a ton of questions, and there's so many people that are going to be interested in this, and at least it helps spur some of their, curiosity on something that I think is definitely really, really important. Now, next month, I've convinced you to come back.
I can't wait.
To talk about arthritis in our dogs and what we could do to help them and all that stuff, and I think laser is part of it, but I see so much of it. And like you said, so many dogs have it. And I really don't think enough pets are getting diagnosed, because when we see them, owners just don't know. And I can tell you that number's a lot. So that will be well received too. So thank you so much, Dr. Just think, 16 years ago.
That's crazy.
I couldn't tell you what the femur was.
Yes, you could.
And now look at me now talking about, potential.
I will just say I am so proud of you for what you've done. I tell people, I brag about you all the time that I knew you when you were a vet student. What you and Danny have done is just amazing. And so thank you for making the world a better place for our pets and helping all of us pet owners, through the tough times. Yeah. Listen,
it's all because of our great teachers like you. So.
Yeah, I don't think so.
And the University of Florida.
Yeah.
All right. Well, thank you so much. I appreciate it again.
Yeah.
Bye, everybody.